It's time for Health Futures with Cypress HomeCare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it is Friday, March the 9th, 2018, and this is a very special day in the Roth household. Mrs. Roth, Susie Roth, is celebrating a birthday today, so big shout out to my wife, Susie, the love of my life. Happy birthday. If you are just tuning in for the very first time, Health Futures is a show about how our older adult population can live a healthier, happier life. And how do we do this? We bring extraordinary guests to the show, and we've now been on the air. We're in our fifth year, have recorded and produced probably close to 200 episodes, 200 shows, and what makes this show are these extraordinary guests, and I've got one here today. It's a friend of mine that I've known for a number of years. I'm going back probably about 12, 13 years. His name is Dr. Carl Hammerschlag. Welcome to the show.
Thank you, Bob. A delight to be with you.
It's good to have you here on the show. Can I call you Carl?
You can.
Well, welcome to the show, and for those of us, or those that are listening in today that don't know who you are, if I could just give a brief description of who you are, you're a master storyteller, internationally recognized author, physician, speaker, healer, and humanitarian clown. You're a Yale-trained psychiatrist. You've spent more than 20 years working with Native Americans, and you're an expert on community-based health care and how to survive in rapidly changing cultures. An authority, a leading authority in practical applications, and this is going to be a hard word for me to pronounce, and that's psychoneuroimmunology.
That's good. PNI for short.
PNI? Okay, PNI. Mind, Body, Spirit Medicine. And that's kind of really how I know you. You were a recipient of the Caring Awards that is really hosted and put on by the National Association of Home Care and Hospice, and the Caring Awards resides in the Frederick Douglass Museum in Washington, D.C. And you have been a speaker for the National Association of Home Care and Hospice for many, many years. And like I said, I've got a great deal of respect for you, and I'm so glad to have you here on the show. And we're going to talk about this throughout the show. There is a big event happening on Sunday. It's at the Valley of the Sun JCC, and you and Dr. Ben Bobrow, who is a distinguished professor of emergency medicine at the University of Arizona College of Medicine and associate director of the Arizona Emergency Medicine Research Center at the university. He also has a little company called the Pain Project, and both of you guys are going to be talking about how to manage chronic pain. And again, it's at the Valley of the Sun JCC. It's from 9 to 10:30 a.m., and that is at 12701 North Scottsdale Road. And if you want to register for it, please give them a call at 480-481-7024 or go out to vosjcc.org/mind-spirit. Well, welcome to the show, Carl. So tell me a little bit about this practice that you have that you refer to as PNI, because that's what I really know you about, mind, body, and spirit.
Well, let me first preface my remarks by saying how nice it is to see you again, spend some time, and recall our long history. So what about PNI, psychoneuroimmunology, a mouthful? It is the scientific kind of name for mind-body-spirit medicine. The idea that the body is an interconnected universe, that what you know and what you do and what it is you feel have got to be in synchrony and harmony. That the world of knowledge, the world of action, the world of emotion, it doesn't matter what you call this paradigm, the head, the lips, and the heart, but those messages need to be in sync. We live in a culture in which people often say things they don't mean, or mean things they don't say. It's become a prerequisite to get elected to public office in this country. But it's difficult for us to be able to separate what's real and what's make-believe, for ourselves as well. The important thing to remember is that what it is you know and think is not the only thing that's going to determine your outcome in whatever it is you face. What it is you feel is at least as important. The difficulty in contemporary life is that for the last 150 years, we have thought that what you think in your head, what can be proven, what it is that you know in your scientific self is really what the truth is. That the truth is closer to what you think and what you can prove than what you intuit and what you feel. And when it comes to dealing with the difficulties of aging or all illness, is the recognition that what you feel is at least as important as what you know, and I believe it's more important. Because when facing difficult times, it is the heart that allows us to dare to dream. The heart dares to imagine what's possible. The head tends to subordinate the dreams to whether it thinks it's likely they might be achieved. So in contemporary medicine, we often drown our dreams in somebody else's sense as to what's likely or possible. PNI tells us what it means to be healthy, something I never learned in medical school. I graduated medical school. I had no idea what health was. I was an expert in the diagnosis of illness, and health was a diagnosis of exclusion. If you weren't sick, you were healthy. I spent most of my life working with Native Americans, an interesting history that I've written about. And that's where I learned about health. And for them, what I am summarizing is the basic teaching. The mind, body, and spirit are critically important. They keep us in balance. The Navajo word for health is the same word as truth, beauty, balance, harmony, and the Great Spirit. I mean, what a wonderful concept.
It is.
That if you are healthy, you are in truth. And the truth is when the worlds of knowledge and action and emotion, the head, the lips, and the heart, the mind, the body, and the spirit are all telling the same story. In an age in which we are used to not telling the truth, and in which everybody anticipates that whatever is being said could be fake, it becomes difficult for us to believe in anything. And when that happens, it's difficult for us even to believe in ourselves. It's critically important to be in touch with what it is that you feel, because it is the launching pad for possibilities.
I love how you put that. And, let's face it, in our society, healthcare is probably one of the biggest oxymorons going.
It's true.
It's sick care, and we treat it that way.
That's absolutely right. We are not caring. We are separating ourselves increasingly from our patients because reimbursability is predicated on procedures and testing. Sitting down and talking to people has become a myth of yesteryear, even though we know that the relationship that you have with whoever your doctor is, your treater, is critically important.
And you talk about testing, and let's face it, a lot of that is being driven by the insurance companies. And testing, we are sent out to get CT scans, MRIs, X-rays, you name it, because they need to do that to, I'd like to say CYA, cover their you-know-what, so that they don't open themselves up for a lawsuit.
Yeah, we practice defensive medicine.
Defensive medicine, exactly.
This is a profession now that is becoming increasingly litigious. So you have to CYA. Somebody is going to sue you. In this culture, if something goes wrong, it's virtually un-American not to point the finger of blame at somebody other than you.
Right.
Somebody else is responsible. That we are doing too many tests, that they are expensive, that they often tell us nothing. but are done simply to be sure that somebody can't sue you in the future. The difficulty is, with all those tests, we're not sure what to do with the results. I mean, we can find things out, but it doesn't mean that we know what to do about them.
Well, and one of the things I want to get into, and we'll talk about in the next segment, is oftentimes after these tests, we're given prescriptions. You know, we have become a pill-popping society rather than trying to get resolution other ways, like you said, by listening to your mind, body, and spirit and having them in harmony.
Well, that's true. I mean, there's enormous collusion in the industry.
Well, I'll tell you what, we got some music that's coming in, a little bit of Coldplay. Thank you, Wes, for bringing that on. You've been listening to Health Futures, Taking Stock in You. I've got Dr. Carl Hammerschlag here in the studio, and we are talking about mind, body, and spirit, psychoneuroimmunology, otherwise known as P&I. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. And I'm your host, Bob Roth, and we're on segment number 2. And if you missed the first segment, I have got Dr. Carl Hammerschlag here in the studio with me, and we are talking about managing chronic pain. And we've got this big event that's coming up at the JCC this Sunday. It is about managing it, and it's the science and spirit of mind healing. And it is being brought to you by Dr. Ben Bobrow and Dr. Carl Hammerschlag. And if you missed our first segment, we were talking about psychoneuroimmunology, otherwise known as P&I, because I really butcher that word every single time. And, I did an intro to Carl, and, a couple things I left off. He's a faculty member at the University of Arizona Medical School. He's chief of community health with Gesundheit Institute. Now, God bless you, right? Gesundheit. That's kind of how I think of Gesundheit, but Gesundheit Institute. He's also the founder of the Turtle Island Project. It's a not-for-profit, multidisciplinary organization whose programs integrate the principles of mind, body, and spirit medicine with Native American rituals and ceremonies. His life work has been chronicled in 5 critically acclaimed books. They include The Dancing Healers, The Theft of the Spirit, Healing Ceremonies, Kindling Spirit, Healing from Within, and 2 children's books. And lastly, he has spent 25 years and has been a humanitarian clown, joining Patch Adams, the world's most recognized humanitarian clown doctor, spreading clown joy and healing in disaster areas, refugee camps, and institutions all over the world. And I remember you breaking out that red nose. You've accomplished a lot for such a young man.
Thank you, Bob.
Well, I want to get back to what we were talking about. So when we ended the first segment, we were talking about how we've really become, to manage chronic pain, we've become this pill-popping society. And, the P&I concept and what it's principled in can help you heal. But we as a society are really looking for those quick fixes, aren't we?
Well, let's talk a little bit about the pill-popping phenomenon. In this country, if you're feeling anything other than wonderful, it's virtually un-American. That there is something for everything that ails you, the result of a perpetual bombardment by pharmaceutical companies telling us that if you're a little bit depressed, there's something that's going to lighten you up. If you're a little bit anxious when you go out in the evening, there's something that can allay your anxiety. If you're having some pain, if you're having discomfort, there is something out there that's going to eliminate it. The side effects are generally repeated faster than goose droppings through a slide trombone, and what it can do to your bone marrow, to your kidneys, to your brain, and the drugs often have not been used for long periods of time in adequate test samples. The point, however, is that we're being sold this bill of goods that if you're feeling something other than wonderful, there is something out there that can treat you. So that we give people something to take care of whatever their symptomatology, rather than helping them understand what their share in the process is in what it is they got and what they can do differently in terms of coming to what it is they have. In this culture, changing your diet, your exercise, smoking and drinking habits, drug-taking habits, is infinitely more difficult than it is to place yourself in the hands of somebody and say, do it to me. If you have a coronary, you can have the vessels replaced, a stent put inside. There are interesting bypass procedures. I mean, we've become very sophisticated technologically. But the truth is, if you don't change your behavior, if you don't eat better, if you don't exercise more, if you don't stop smoking, if you continue drinking, those kinds of things, that you're going to come back in 5 to 7 years, the average length of stay after a procedure, before you again become symptomatic. And most people then say, well, I'll have the procedure again. We make it too easy to place ourselves in the hands of others to do it to us. The truth is that the healthcare profession needs to inspire people to imagine that they can become the principal agents in their own healing, instead of perpetuating the fraud that there is a pill out there, something other than you, that's going to alleviate you of the burden of becoming the principal agent in your own healing. We have kids. Literally 1 out of 7 children is developmentally disabled since the advent of attention deficit disorders.
1 in 7. Wow.
Most of those kids have ADD, ADHD, and we're giving them chemicals that have a profound influence on the brain and whose long-term effects we don't know a whole lot about.
On our organs, liver, kidneys, stomach.
All of the above.
Yeah.
But we don't have enough teachers. We don't have enough time.
Right.
They are dramatically underpaid, and especially in this state as well. So if a kid is acting out, and the TV sets are giving you a pharmaceutical solution, if you are jittery, if your legs are shaking, if you are talking rapidly, if you are disruptive, you're pulling hair, then you ought to be chemically subdued. And by and large, they don't work, and they come with a terrible price. And kids continue to take them if they don't respond. So we increase the dose. We would change mental illness in this country if we simply restored the dinner meal to a family ritual, turned off our phones, and talked to each other about who we are and where we come from and what's important to us and what you believe and what your values are. From generation to generation, the transmission of some kind of story about what makes you unique in the world. But we don't talk to each other anymore. We become captivated by our technology, and the intimacy of what was the dinner meal has gone by the wayside. An uninvited guest at every dinner, whether at home or in a restaurant, is a cell phone, which nowadays are placed on the table like an uninvited guest who is ready to make an appearance. We need to spend more time away from the idea that somebody else is going to do it to you or for you, and more time imagining that you can be the principal participant in staying healthy. The critical elements are that doctors, healers, need to have a relationship. But relationships, time, are not reimbursable. To have this kind of discussion, to talk to somebody about what they think and feel, to be able to tell them that you are with them as a intimate part of the process, then you will be with them. And you will give them some options, and you will show them what it is that they can do for themselves if they want to stay healthier in the future.
I'll tell you what, you said a lot there, and I'd like to just unpack a couple things. First of all, you talked about medical procedures, and whether it be a stent being put in, bypass being done, you would think that somebody would get that wake-up call, and they would say, whoa, I need to lose some weight, I need to stop smoking, I need to exercise, I need to do all of these things because I just got a scare. But like you said, we make it so easy for them. Let me go back to what I was doing. If it happens again, I'll just get it fixed again. It's like taking my car in to get fixed. And then you talk about the pills. And it's interesting. You talk about these kids. And, I still have one that's in a graduate program up at NAU, speech therapy, and I got one in nursing school at U of A. I know you'd like that being a professor at U of A. The amount of drugs, and I'm not talking the drugs that we saw back in the 60s and 70s, but I'm talking about the stimulants, the Vyvanse and other stuff that's available on the black market in the schools, especially when testing comes up. I mean, these are out there for all these kids to take, and they're being unprescribed.
Well, it's true, and it's not just young children. People in college are taking them to prepare for the examinations.
Right.
University professors who are required to write, in addition to teaching, do original research and publish, are taking it to be able to stay awake at nighttime so that it increases their productivity. But by and large, there's stuff available out there that we believe if we are not taking, that we're going to be on the short end, that other people have an advantage because there are chemicals that are enhancing their performance, whether it's physical or intellectual.
We as human beings are looking for edges, and that's the edge that they're looking for using those chemicals. And the last thing I want to talk about is an article I wrote a couple months ago about digital detox. The fact that we are connected to our devices and we go out in public, go to restaurants and seeing couples right across from one another, not talking, but both on their phones.
Well, think about that.
Well, let's pick up on that in the third segment. It's hard to believe we're down 2. You've been listening to Health Futures, Taking Stock in You, and I've got Dr. Carl Hammerschlag here. And we're talking about managing chronic pain. We're up halftime here, so stick around. We'll be back. We're going to talk a little bit more about this when we get back. Take care.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. We're in our third segment here with Dr. Carl Hammerschlag, and I'm your host, Bob Roth. And if you missed the first 2 segments, we're in our third segment. If you missed the first 2 segments, go up to my website at cypresshomecare.com. Click on the media button, hit the drop down. The third button down is radio shows. You can catch almost 200 of them, but the one here you're listening to is the one with Dr. Carl Hammerschlag. You can catch those first 2 segments, and you'll catch these last 2 as well. Well, Carl, we were talking about the devices, the distractions, and the fact, and I like to say, that are keeping people from being present. And they are distracted by these great inventions, but these inventions that we have are meant to make communication easier or making it much harder.
Absolutely. I think there's no question. The instruments of our technology, our cell phones, for example, our handhelds, were intended to free us. The idea that somehow you wouldn't get trapped in an office, that you could go outside, take care of business, and still do all the things you want. And the truth is that the instruments have so captivated us that it's virtually impossible for us to get away from them. Instead of freeing us, they have absolutely co-opted our attention. They make it possible for us to always be someplace other than where we are.
Right.
And the corollary to that is it makes wherever we are never enough. You're always anticipating something else may come up, something else may be happening, something more interesting, something better. So you have to be somehow on call, whether it's at the dinner table with your family, whether it's at school, whether you are partying, whether you are having dinner with friends, one is always available to being someplace else.
What's interesting is to these kids and young adults and even older adults, if it didn't happen on Facebook, then it didn't happen. So they feel the need to chronicleize the events that are happening in their lives, their vacations, the food they eat, the engagements, the parties. And for those that aren't in that circle, I would imagine some feel left out. I mean, for my wife and I, we don't, but there have to be people that look at these lives that people put up there. And for me, it's facade. I mean, you have 1,000 Facebook friends. So what? They're not real friends. Where are your real friends?
There is this syndrome, FOMO, fear of missing out.
Exactly.
The idea that something is going to pass you by. Nobody wants to lose anything. So that there isn't a child under the age of 18 that is more than an arm's length away from their cell phone, feeling naked without them, even though what it is that's being shared is not necessarily an intimate conversation or a realistic presentation of who you are and what you're about. If you can't summarize what you're saying in a tweet, a soundbite, or a 2-minute YouTube video, nobody's going to pay attention to you. So that the really important questions, the existential questions, how to deal with pain and suffering, how do we deal with the illnesses and traumas that happen in our lives, how do we share our experiences, how, instead of when you're feeling sad, taking a pill, that you can find somebody who's walked this path as well and can share with you what it is that they have done that allows them to get beyond their pain and suffering. Those kinds of conversations are no longer held, even though we know that 80% of the people who are depressed will get better as a function of time. Feeling depressed is different than having clinical depression. It doesn't mean you need a pill. What you need is somebody to talk to while you're feeling miserable that can remind you that the way it is not necessarily the way it's going to be, and that people have been resilient and faced such things in the past, and you want to learn other ways of how you come to it. The secret, if there is one, about being able to deal with whatever happens in your life is to understand that stuff happens, as the kids say in the street. Well, not quite what they say. The issue is not what the stuff is that happens, but the choices we make about how we come to that stuff.
Right.
And that everybody's got a choice other than placing themselves in the hands of someone else or something else, a drug, a pill, that is going to allow you to become an agent in your own healing so that when more stuff happens in the future, you've learned the tools to be able to deal with it.
No better words have been said. Seriously, Carl. I love it. And, I want to pivot just a second here and just tell you that a couple weeks ago I got a chance to spend some time with Dr. Michael Crow. And, one of the things he said, it's kind of a line that came out of the show Hamilton. And he said, today, right now, is the best time to be alive in mankind. He said, turn off the news. But look at what we're doing in society. And look at the inventions and the innovations and just some of the great things that we're doing and not be so focusing on all the bad stuff. Because, you know what? Talk about depressed. Just turn on the news. Turn on the news and you hear what happened in Parkland, and you hear what happened in Vegas. I mean, these are horrible things, and it's enough to get somebody depressed.
No question about it.
No question about it. So, getting to our next topic. First of all, I wanted to share with you there's something you and I have in common. We both have 3 daughters. And, I want to ask you a question, and that is, you are, very successful in what you do, and you have lived and continue to live an incredible life. What's the secret?
I don't know.
Especially with 3 daughters.
You have to be surrounded. You have to be surrounded by love. Love is always the answer.
I love
We
it.
live in a society that's essentially unloving, that reminds us increasingly of cynicism, divisiveness, a culture in which there is no longer a definition of what's right or wrong. What's right or wrong is based on what you can get away with. So in this kind of atmosphere, it steals from us our joy. We continue to identify only with our divisions, and it's unhealthy. Love.
Well, I'll tell you what, both of us have been blessed with 3 healthy girls, and there's that old saying that your son is your son till he takes a wife, your daughter's your daughter for the rest of your life. And I feel very privileged to have 3 extraordinary daughters, and I know you and Elaine do as well.
Oh, no question. I'm sure that the parents of Son feel similarly. But having daughters and raising daughters, or more accurately, being raised by them, has been the most profound teaching experience in my life. They help you not take yourself seriously. Our children remind us of what we like best about ourselves and mirror what it is that we like least as well, so that you want to open yourself up to seeing yourself in its totality and still being loved in spite of your flaws and imperfections. If you can surround yourself in a loving community rather than a divisive community, if you can wake up and say thank you with enormous gratitude for the gifts that surround you, you're able to come to every day with passionate joy. And it is the greatest act of revolution in contemporary American life, is to find a way to come to every day with joy.
I love it. You said it so well. And what a great way to end our 3rd segment. We got one more segment coming up. I'd like to talk about chronic pain, and I'd like to talk about our upcoming event that's going to be happening at the JCC. That is this Sunday at the Valley of the Sun JCC. Call them at 480-483-7121 or go to vosjcc.org/mind-spirit. And just to conclude our 3rd segment, it's about love. Love makes the world go around and makes everything better. You've been listening to Health Futures. We're down our 3rd segment. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. And we are on our 4th segment. If you're just tuning in right now, I've got Dr. Carl Hammerschlag here in the studio. We are talking about promoting this big event coming up on Sunday. It is Managing Chronic Pain, the Science and Spirit of Mind Healing. Learn about the powerful science around the mind-body connection and how it can manage chronic pain without risky medications and invasive procedures. Again, that's Sunday from 9 to 10:30 at the Valley of the Sun JCC, 480-483-7121. So just getting back to you, Carl, because you said it so well in our 3rd segment, really talking about love and being present and not being distracted by devices and all the stuff that is out there. You know, as I talked about the news, which can depress you if you watch the news and that's all you do. And I talk about being present and being present in the surroundings of your family and the people that you love. Talk to me about managing chronic pain and some of the things that you are going and Dr. Bobro are going to talk about on Sunday.
Well, good. So this is another reflection of the theme that we addressed in the earlier segments. How do we come to it instead of how is it coming to us? It's you who have it, not it that has you. It's you who have the pain. If the pain has you, then you have to wait for somebody outside of you. You have to wait for the proverbial St. George to come and slay the pain monster. If it's you who have the pain, you have to find some way to stand still and somehow acknowledge, I got it. What are my choices in terms of how I come to it? The old Indians have a metaphoric tale The snake monster is called Siskiotl among the Coast Salish tribes. It is a giant snake, 60 feet long, as big around as a redwood tree. It's got a head on both ends. It is frightening. If you come across it in the woods and you see it and run, it comes after you because nothing falls outside of its peripheral vision. It comes one side, the other, until it grabs you and eats you. The old sailors say, when you see the fear monster, stand still, don't move. Even if you reflexively twitch, the monster will see you, and having seen you twitch, it'll come after you, but you're not running away now. You're standing still. It comes after you, one side, the other, until it has you trapped between both of its heads. And then suddenly, seeing itself reflected in its own eyes, it becomes so horrified by its own image that it slinks away in horror. It's a metaphor for how it is that we come to our fearfulness, to our pain, to our suffering. You have to find a way to stand still and be able to look at it and not run away from it and hope somebody is going to chemically take it away or surgically extirpate it. How are you going to come to it? What choice do you have? And you always have choice. You always have choice. So chronic pain. We know that we can alter our perceptions of pain. When I was a kid, I skinned my knee down to the bone. I ran home from school, 10 blocks. I had no pain at all. But when I knocked on the door and my mother answered, I collapsed. I couldn't move. I was in pain. We know that an anesthesiologist who speaks to their patients prior to surgery, takes time, looks at them, says, look in my eyes. You will not see my face in the operating room, but you'll see my eyes, and you will hear my voice. Everything's going to be all right. And you will not need much post-operative medication at all. You're going to be up and around and mobile. Those patients who are talked to do much better and require very little pain medication. Suggestion is a potent instrument.
Oh, it is.
And if people believe in you, if they like you, those are the crucial variables that help people get well. It's the personal qualities and attributes, not the degrees on the wall, but your ability to connect at some heartfelt level so that they trust and believe. Makes a difference. Belief is critically important. We've done research recently, orthopedic surgeons doing surgery or sham surgery on people with chronic osteoarthritic knee pain. And it was double-blind. Some people had surgery. Some people had sham surgery, that is, they opened them up and closed them without doing anything other than an opening incision. And the additional variable was that people talked to the patient. So if the orthopedist talked to the people they were operating on and had a relationship with them, I mean, really talked, those people did extremely well. Those people who were talked to by their doctor and did not have surgery, did almost as well as the people who did. The people who did least well are the people who did not talk to anybody. They just came in, told them what the procedure was going to be, but had no relationship at all. Those people who had surgery but were not talked to didn't do as well as the people who did not have surgery but did have a relationship. And those people who did not have surgery and were not talked to did least well. The point is that we can imagine something beyond what we see before us if we choose to look at the familiar with new eyes. Most of us don't want to look, don't want to do the work that's required to change how it is that we come to the event. As we spoke about earlier, we place ourselves in the hands of others and say, do me. Do me once and do me twice. And if my cardiac disease comes back and I don't change my behavior, most people don't change their behaviors, by the way, it's a price people are willing to pay. Choice.
It's choice, but you hit the proverbial word, too. You got to do the work. And nobody said it's easy. You know, and that, my friend, I think, is what everybody looks for, is they look for easy.
And quick. In this day and age, quick is the name of the game. Fast.
Right.
Nobody wants to suffer, not even for a millisecond. And as I say, most TV pharmaceutical advertising is predicated on the assumption that if you're feeling anything other than wonderful, there's a pill that can help you, until we begin to believe that it's true. The demand for opiates, narcotics, and all kinds of other drugs comes from this idea that quick and easy solutions can be had by almost anyone.
Well, that is a great lead-in to wet our listening audience's whistle. Come hear more this Sunday at the Valley of the Sun JCC over at 12701 North Scottsdale Road from 9 a.m. to 10:30 a.m. Come hear Dr. Hammerschlag and Dr. Ben Bobrow. Sign up at Valley of the Sun JCC. That's vosjcc.org/mind spirit. Phone number is 480-481-7024. Carl, I can't thank you enough for being on the air. You know, one thing I want to say is I did at the top of the show wish my beautiful bride a happy birthday, but I also, you and I share something in common. We lost a good friend last year. Val Halamaderis left an indelible mark on me and what I do every day, as he used to say, to fight the last civil rights battle, and that is the rights of the infirmed and the elderly. He's going to be truly missed. Rest in peace, Val Halamaderis.
A remarkable man. Thanks for remembering him and reminding us of the dreamers and prophets in our time. And happy birthday to your wife as well. I want to be sure that I say that too.
Well, please send my best to Elaine. And I know you have a special birthday coming up next month.
I do. That's secret.
Well, I'd like to have you back on the show, maybe later on this year. You've been listening to Health Futures Taking Stock in You. I'm your host, Bob Roth, and I've been very pleased, and it's a pleasure to have Dr. Carl Hammerschlag here on the show. Come see us at the JCC this Sunday. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress HomeCare Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.